Hey, good afternoon, everyone. Thank you, Neri. We are really friends until now. And I am really a wire. And once a wire will always be a wire. Thank you very much for your invitation. YWCA of the Philippines have been our partner in mental health advocacy in the Philippines. And I'm very excited this afternoon, more excited than nervous, to share with you highlights of mental health in the Philippines and also about stress and trauma and how to do self-care in the midst of a pandemic. So I'm very happy also to see some of my students here from Perpetual, PWU, and also from De La Salle, Las Marinas. So thank you also to our Youth Council and also our President, Dr. Ma'am Parinas. Thank you for inviting me, and I was given an opportunity to share with you about mental health. This is really my advocacy. So I'll start by sharing my screen. So I'll be starting with stress and trauma because I wanted to end in a positive note on self-care. Okay, so I'm very excited with the White Talk series. Even though we are in the midst of a pandemic, it must not stop us to do productive work. That's why I salute YWCA of the Philippines for really spearheading White Talk series, not only for women, but also for men, adolescent, children, parents, mental health advocates, practitioners, and I'm very happy to share my talk with you this afternoon. So the objectives of our webinar, so for you to understand stress and how to have a healthy well-being, the difference between acute stress disorder and PTSD or post-traumatic stress disorder, and the importance of self-care in the midst of a pandemic. I will also be discussing new ways of taking care of oneself based on the present environment and available resources. Okay, so I'm giving you statistics on what is really happening around the world. So presently, this is from a February, February 10 data. Okay, so around the globe, no, the global situation based on World Health Organization dashboard. So confirmed cases were 106 million already, more than 106 million, and we have more than 2 million deaths from COVID-19. So it's the first time that we have experienced a pandemic of this magnitude. And I believe that as Marla was sharing a while ago, that anxiety, worries, and even depression are really very prevalent because of what is happening around us. So these are the top four countries having confirmed cases of COVID-19. So we have the USA, 26 million, 832,826, followed by India, more than 10 million, Brazil, 9 million, and the Russian Federation, 4 million. So how about in the Philippines? So we are more than half a million, 540,227 confirmed cases, and we have 11,000 more deaths, 11,296 deaths because of COVID-19. And we are talking about uncertainty. So I first heard the phrase, the anxiety of uncertainty, with PAP and PGCA, during their talks. And really, we are very uncertain about our future because of COVID-19. And based on an article of Embrace Relief 2020, COVID-19 impacted our physical health, financial stability, and the mental health condition. So these are the three waves of the global impact of COVID-19. Then I think the latter part of 2020, we have heard about the new variants of the virus that causes COVID-19. So if this article was updated February 2, 2021. The multiple variants of the virus are circulating globally. So we know it started from the United Kingdom. Then we have South Africa, a variant called B.1.351. And in Brazil, a variant called P.1. So with these new developments in COVID-19, we can say that the global impact of this virus is not yet over. So what we don't know. So scientists are working to learn more about these variants, and more studies are needed to understand how widely these new variants have spread, how the disease caused by these new variants differs from disease caused by other variants that are currently circulating, how these variants may affect existing therapies, vaccines, and tests, and how will it impact us as a person, as an individual. So public health officials are studying these variants, to learn more to control the spread. They want to understand whether the variants spread more easily from person to person. Would it cause milder or more severe disease in people? Are detected by currently available viral tests? Respond to medicines currently being used to treat people for COVID-19? And will it change the effectiveness of COVID-19 vaccines? So presently in the Philippines, we are preparing for vaccination already, and I saw in the news that we are simulating already how to take care of these vaccines. No? So what it means for us with the new variants. So COVID-19 pandemic drastically changed the way we live. So family relationships were affected, our work modality. So most of our workers are working from home. It is also drastically affected the educational system and how to manage ourselves. So at first, no, during the lockdown, I believe that many of us are really confused. Many of us are really worried what will happen in for tomorrow, what will happen to our work, to our situation. So self management is really one area drastically affected by COVID-19. And the typical family routine before the pandemic. So we know that before the pandemic, dad goes to work every day, mom stays at home to do the household chores and takes care of the baby. Sister goes to school also every day. Brother goes to school every day, while the baby stays with mom and plays every day. So this is the typical family routine before the pandemic. But because of the pandemic, families are forced to stay at home and be together every day. And this may result to misunderstandings and fights. Not every family, no? But there are families, no, because they are not being used to be with one another 24 hours a day. No? So it may result to misunderstandings and fights. And the situation of the family during lockdowns, I have read in an article by Isguera, Inquirer.net, that Quezon City reopens protection center amid rise in domestic violence during lockdowns. Not only domestic violence, but also abuse, no, with women and children, no, arise also when I attended a webinar also on child protection rights. So because of the many sources of stress, we may become anxious or worried. So I want you to type in our chat box, yes or no, if you are experiencing the following. Okay? So you just type in our chat box so that you will be engaged also in our discussion this afternoon. You can type in our chat box, yes or no, if you are experiencing the following. Number one, aches and pains in other areas of your body. Is it a yes or a no? Wow, there are many yeses, okay? Chest pain, or as if your heart is racing. So there are few no's, but there are many yeses. Many yeses. Okay, type in your answers in our chat box. Next, exhaustion and trouble sleeping. Are you experiencing this? Yes or no? Okay, sometimes, others no. It's very good. But many yeses again. Okay, next, muscle tension. Are you experiencing muscle tension? You are feeling your muscle getting tense because of the situation. So you can feel it in on your shoulder, your arms. And next one, stomach and digestive problems. Are you experiencing diarrhea? Is your stomach aching? And you have problems with your digestive processes or systems? A yes or a no. And lastly, irritability. Are you irritable the whole day? Or do you get angry easily because of what is happening around you? because of the situation of your family? Are you feeling irritability? Yes, sometimes. Sometimes. Not everybody is experiencing irritability. Okay, so these are all signs of stress. Okay, so are you stressed out this afternoon? I'm glad you attended this Y Talk series so that you'll be able to learn some techniques to be able to address your stress. So let's talk about stress. Okay, so what is stress? This is very common. Everybody feels stressed sometimes, and hopefully not every time, okay? So when you are stressed, there is emotional and physical tension. Okay, your body is tense and also you are quite panicky in terms of your emotions. Body reactions to challenges or demands. And triggers may include events and situations from the family, school, work, community, even your partner, etc. Okay, so this is stress. Stress can also be positive for a short period of time because it warns us of an impending danger. So when you look into our autonomic nervous system, which controls our heart rate, breathing, vision changes, and more, its built-in stress response or the fight or flight response helps the body face stressful situations. So we have that, no? It's built in us. Either you fight or you flight, okay? If you are walking and suddenly there is a snake in front of you, okay, don't fight, okay? Flight. No, because it's really very dangerous. So the fight and flight response is very common in our body. That's why we feel stress sometimes, no? Especially if you are taking exams. We feel stress, we feel the tension. No? But after taking the exam, no, we feel also our body returning to its homeostasis or balance. Okay? And our parasympathetic and sympathetic processes are really working. No? But if you are stressed for quite some time, no, and your body is not returning to its homeostasis, that's where the problem will start. When a person experiences prolonged stress, this can cause problems. The stress response during long periods may cause wear and tear of the body. Okay, if you're always stressed out and you are not doing something about it, and you are experiencing it in a prolonged period of time, so it will eventually lead to problems later on. Okay, so I have read many articles, no, because I like doing research. Okay, so one of the article written by Luo and Shao in 2020, that survivors of COVID-19 are at high risk of post-traumatic stress disorder. No? PTSD has a different phase now because of what is happening around us. No, before PTSD is more on trauma during events of war and other traumatic experiences. But now, psychological trauma is being caused by COVID-19. Okay? So, there are three groups for PTSD. Three groups of people who have experienced trauma. Number one, the first is directly experiencing suffering from symptoms of a traumatic treatment or event. Okay. Number two is a witness. You can have PTSD even though you are just a witness. Witnessing of patients who suffer from, struggle against, and die of the infectious disease, which has a direct impact on fellow patients, family members of patients, or people who directly provide aids and care for the patients. Okay. And the third is experiencing the realistic or unrealistic reality of the infection, social isolation, exclusion, and stigmatization. This directly affects patients, family members, care and health providers, or even the general public. Okay, so we are very thankful for YWCA Philippines for having this kind of White Talk series for us to have an information about what is happening really in our situation, especially to our family members, to our friends, and even in our communities. Okay, and even psychotherapists are being affected by the pandemic. In the study of Van Dorn, Beck, Sprout, and Hoffman in 2020, the title of their article is about psychotherapy's vicarious traumatization during the COVID-19 pandemic. So there are many psychotherapists who are really experiencing vicarious traumatization. Among 339 therapies, who were surveyed, 15% experienced high levels of vicarious trauma, and others experienced moderate levels, no, mild to moderate levels of vicarious trauma. Okay. A higher level of vicarious trauma was associated with younger age, less clinical experience, and negative experiences on the online treatment. The results implied that there is a need for personal and professional support for therapists working remotely amid a global health crisis. So this article was published by APA in their PsycInfo database record. So marami to, no? There are many trauma and stress disorders, no? But I'll be talking about two common stress disorders, no? Acute stress disorder and PTSD, because they are quite related, somewhat related to one another. Okay, when you say acute stress disorder, it is under the disorder class, trauma and stress-related disorders in DSM-5. Okay, so when will you know that a person has acute stress disorder? So like PTSD, acute stress disorder, there is also an exposure to a traumatic event. No? Ang kaibahan lang ng acute stress disorder, the symptoms was immediately experienced three days, no, to 1 month. No? PTSD, no, the symptoms are experienced after a month. Yun lang yung kaibahan. No? But all the symptoms, all the areas are really quite related. No? Okay, so exposure to actual or threatened death, serious injury, or sexual violation in one of or more of the following ways. No? Directly experiencing the traumatic event, witnessing, no, in person the events as it occurred to others, learning that the events occurred to a close family member or close friend. Note, in cases of actual or threatened death of a family member or friend, the event must have been violent or accidental. It was not expected. There are many testimonies about unexpected death during the COVID-19. Experiencing repeated or extreme exposure to aversive details of traumatic events. Example are first responders collecting human remains, police officers repeatedly exposed to details of child abuse. Note, no, this does not apply to exposure through electronic media, television, movies, or pictures. So this is a direct exposure. Okay, the diagnosis of ASD can only be considered from 3 days to 1 month following a traumatic event, commonly referred to as the acute phase. If post-traumatic symptoms persist beyond a month, okay, doon po siya magkaiba, the clinician would assess for the presence of PTSD. The ASD diagnosis would no longer apply. B, presence of 9 or more of the following symptoms from any 5 of the categories of intrusion, so intrusive thoughts, negative mood, dissociation, avoidance, and arousal, beginning or worsening after the dramatic events occurred. So intrusion symptoms include recurrent, involuntary, and intrusive distressing memories of the traumatic event. So note, in children, this is different. No? Repetitive play may occur in which themes or aspects of the traumatic event occurred. Number 2, recurrent, distressing dreams in which the content or effect of the dream are related to the event. So napapanaginipan, no? And for children, these are frightening dreams. There will be also dissociative reactions like flashbacks, in which the individual feels or acts as if the traumatic events were recurring. Parang totoong-totoo talaga. No? Totoong-totoo talaga. Such reactions may occur on a continuum, with the most extreme expression being a complete loss of awareness of present surroundings. So for children, trauma-specific reenactment may occur in play. And number 4, intense or prolonged psychological distress or marked physiological reactions in response to internal or external cues that symbolize or resemble an aspect of the traumatic event. Okay. Psychological distress, no? Intense and prolonged. Negative mood, persistent inability to experience positive emotions. Example, inability to experience happiness, satisfaction, or loving feelings. And dissociative symptoms, an altered sense of the reality of one's surroundings or oneself, seeing oneself from another's perspective, or being in a daze or time is slowing. 7, inability to remember an important aspect of the traumatic event. typically due to dissociative amnesia and not to other factors such as head injury, alcohol, or drugs. And there are avoidance symptoms. Efforts to avoid distressing memories, thoughts or feelings about or closely associated with a traumatic event. So I have clients experiencing this and they are really having a hard time. Every time they see the place, no, they tend to really what? Generalize the connection or the association. Efforts to avoid external reminders like people, places, conversations, activities, objects, situations that arouse distressing memories, thoughts, or feelings about or closely associated with a traumatic event. And of course, sleep disturbance, difficulty falling or staying asleep, restless sleep, irritable behavior or angry outbursts, hypervigilance, problems with concentration, and exaggerated startle response. Okay. Sometimes there are expressed verbal or physical aggression for arousal symptoms. So the duration of the disturbance is 3 days to 1 month after the trauma exposure sa ASD. The disturbance causes clinically significant distress or impairment in social, occupational, and other important areas of functioning, and the disturbance is not attributable to the physiological effects of a substance or another medical condition. So if all of these criteria or 4 or 5 criteria were met by the client, an ASD diagnosis can be done based on thorough assessment of the clinician or therapist. And then we go to PTSD. Okay. So there's an article written by Tucker and Zapla in 2021. Post-COVID stress disorder, another emerging consequence of the global pandemic. So aside from the death toll, the pandemic has triggered significant emotional, physical, and economic problems around the world. Okay, so you will see here protective factors based on this article. So we need these protective factors to be able to remain healthy and positive even though we are in the midst of the pandemic, like the social support group, financial stability or employment, healthcare resources, safe workplace, wellness programs, adequate PPE, promoting adversity, and timely COVID-19 testing. Okay, these are the protective factors. And based on our situation in the Philippines, some of the protective factors are not available. So that's why the anxiety and worry is really rising or increasing. And these are the traumatic stressors, severe illness, hospitalization, witnessing death of a loved one, and extreme exposure to COVID-19 details. And we have also the general stressors. COVID-19 exposure or the quarantine period, social isolation, employment or income loss. Many of our kababayans are really having difficulty now financially because of the impact of COVID-19. Working from home with kids, being a caregiver, making difficult medical decisions, and inadequate PPE. Okay, so this is based on the article of Tucker and Zapla. So after ASD, we have post-traumatic stress disorder. So it's the same. No, it's just that the duration is 1 month after the traumatic event. So ASD or acute stress disorder, 3 months to 1 month. Okay, so you would see here also exposure to actual event of trauma. There is also intrusion symptoms, avoidance symptoms. We have negative symptoms also and other alterations, like difficulty of falling asleep, the arousal symptoms. It's the same, almost the same with ASD. Okay, so one area I would like to discuss with you is how we address mental illness in the Philippines. This is very challenging for Filipinos. Only in 2018 that we have a mental health bill to address our mental health needs in the Philippines. Actually, we are last among the few countries who had a mental health bill, because of, for some reasons, that we were not able to really have this law to be able to really address mental health concerns in the Philippines. So, in an article also of Colau and Brown, 2020, their article is about Filipino help seeking for mental health problems and associated barriers and facilitators, a systematic view. So the respondents were Filipinos across the world, and they have a general reluctance and unfavorable attitude towards formal help seeking despite high rates of psychological stress. And based on the article, most Filipinos prefer seeking help from close family and friends. So what else? Barriers cited by Filipinos living in the Philippines include financial constraints and inaccessibility of services, whereas overseas Filipino workers were hampered by immigration status, lack of health insurance, language difficulty, experience of discrimination, and lack of acculturation to host culture. So these are the barriers. No? And both groups, no, were hindered by self and social stigma attached to a mental disorder. And by concern, no, for loss of face, sense of shame, and adherence to Asian values of conformity to norms where mental illness is considered unacceptable. So there is stigma still in the Philippines, and commonly we shrug off mental health concerns. And based on my experiences also with clients, some families make fun of this. They just don't want to address it. They are saying it's just a phase they are going through. You are not just you are not just listening or following instructions from your parents. You are being matigas ang ulo. So these are all hindrances or barriers, so that we can address directly mental health issues within our families. Okay, so we have the Philippine Mental Health Law. This is an act establishing a national mental health policy, and I think it is more on giving a budget for the mental health needs of Filipinos, giving hospitals enough funds for this, and very important is having mental health practitioners in the community level. No, yung community level natin sa mga barangays, so that when mental health needs will arise from families in barangays, there is someone, or there is a place or a venue where they can go to address their mental health concerns. Okay, so how to handle stress and trauma? Okay. So if you are a person, so we are talking about how to handle stress and trauma. Okay, so if you are here, if you are experiencing these symptoms, never do self-diagnosis. Okay, that is very dangerous, and it will add more anxiety and worry to you. Okay, so address the situation early on. Talk to a counselor, psychologist, or psychiatrist on what you are going through. Okay, keeping it to yourself will not help. You have to reach out to someone because help is available. Okay. Next, if you have loved ones experiencing ASD or PTSD, okay, tell your loved one you want to listen, and that you also understand. You will also understand if he or she doesn't feel like talking. Okay, so huwag naman nating pilitin. Listen, and listen well. Use kind words of understanding than judgment. Like, if you are going through this kind of situation, I know people who can help you, and we can refer your condition to them. So always with understanding. Never downplay an experience. Like, hindi naman yan, positive thinking lang yan. So kasi yung mga experiences na yan, they are sharing it to you. Our loved ones is sharing this to us because they are feeling it real time. Naramdaman po talaga nila. Based on my experiences with clients. And some of the clients do not want to tell the families about it because some of them, they make fun of the situation. O yan si nag-arte-arte lang siya. I don't know if you are hearing that. Medyo lungkot-lungkutan lang siya. But these are all valid experiences that they are sharing to you. So we need to use kind words of understanding than judgment. Next, offer to go to doctor. And if you can accompany your loved one and also keep track of the appointments, show them your support. It is very important. Okay. If you are a counselor or a psychologist or a therapist, learn about ASD and PTSD. Read empirical studies and evidence-based practice to address this concern. And we do CPD, right? Lahat tayo, CPD tayo. We attend additional trainings to be able to better equip ourselves in handling clients. And number 3, I want to give you more thoughts on this. Work together with your client as you do therapy or counseling with patience and love. Nararamdaman po ng client natin if we are truly concerned and we love them. And listen very well. Okay? Psychopharmacological interventions can be done only by psychiatrists. Sila lang po yung nakakapag reseta ng gamot, no? And psychotherapies can be done by psychologists, no? Guidance counselor can do counseling. And these are all available, no? Pwede po natin itong ma-avail, no? Because help is really available. Okay. If you are a mental health advocate or volunteer, you further your studies in the field, attend trainings and workshops and webinars like this, and listen well. Active listening is very important if you are a volunteer, no? And know how to refer and when to refer a person, no, to professionals. So give me a thumbs up. Okay? Ready po ba kayo? Meron tayong thumbs up feature dyan. Give me a thumbs up if you are doing regular physical exercise. Thumbs up nga dyan. Baka natutulog na yung iba. Number 2, practicing breathing exercise. Do you know how to breathe well? Next, eating healthy. You are not an emotional eater. You don't eat junk foods every time you are stressed out. No? You are eating healthy, nutritious food. No? Foods rich in protein. Staying positive or thinking positive. Thinking positive and happy thoughts. Okay? Oh, many yeses, no? Very good. I'm very happy that many of you are really thinking. So we are talking about self-care. We do it deliberately, no, to take care of our mental, emotional, spiritual, and physical health. So I hope I will not be disconnected anymore. Okay. Okay. So for the World Health Organization, self-care is the behaviors you do to take care of your own health. And it includes our hygiene, okay? So yung hygiene natin, yung washing our hands, mask and face shield, these are all self-care behaviors, okay? Including nutrition, leisure activities, sports, exercise, seeking professional healthcare services when needed, and much more. Okay, so, naiba na yung complexion pati ng self-care, no? Because of the COVID-19 pandemic. No? If you wanted to really care for yourself, do the guidelines on frequent washing of hands, no, yung ating po mga face mask, face shield. Okay. So self-care is not forcing ourselves to do something we don't enjoy doing. Okay. When we say self-care, we are enjoying doing it. Okay. So when we do exercise, tapos after naman natin mag-exercise, we feel so tired, no? Parang walang nangyari sa ating positive. So it is not self-care. Self-care should give ourselves enjoyment and relaxation. Okay? So self-care also is something that refuels us rather than takes from us. So it gives us an additional burst of energy. No? Pag nag-self-care ka, if you take a few days off, pagbalik mo, dapat meron kang new burst of energy. No? That is self-care. Okay? And the beneficial effects of self-care include improved well-being and lower morbidity, mortality, and healthcare costs. This is based on sa article ni Dunbar, August 2019. Good self-care is key to improve mood and reduce anxiety, a key to a good relationship with oneself and others. So that is self-care. If you are taking care of yourself, you are having good influence also and good relationship with other people. So it says in Mark chapter 12, verse 31, love your neighbor as yourself. So you have to take care of yourself. Why? No? Because the extension of your love to others is what? It's very basic and founded on how you love yourself or take care of yourself. So there are many complaints about self-care. No? Commonly, working women will tell you there is no time for self-care. A busy dad will tell you there is no time. Just put some time, no, to really take care of ourselves. Illustration, like what happens to a car that does not go in for its maintenance? No? There will be mechanical failure and car lifespan is reduced, no, based on an article of Annie Chang. Okay, so the fragile system needs maintenance or self-care to sustain itself. So like us, no, like people like us, no, mental health and physical issues such as nervous breakdown or an illness may happen, no, if we will not care for ourselves. So it's very, very important that we do self-care. Okay. So what are the consequences of not practicing self-care? So there is low energy in the middle, feeling hopeless, less patience, difficulty falling and staying asleep, increased headaches, stomach aches, and other physical symptoms, and stress. And then it will eventually lead to less patience with your children, reduced performance at work, and less motivation to engage in social activities. That's why self-care is very important. This is one concept that we need to understand. We have to listen to our body. Never force it, no. Especially if your mind is telling you you can still do it, but your body is really so tired, no, so tired. And many attacks, no, heart attacks, high blood pressure, no, they escalated, no, because many people do not listen to their bodies.
Hello.
Because your body will be the first to tell you, I need to rest. So 7 to 8 hours of sleep is very important. We need to really do that. And then communicate with our family. No? Discuss with them that you have to do activities for self-care. So ang gagawin nating mga activities, what is available inside our home. No? Okay. And what works for you. No one size fits all self-care routine. So you have to really assess your situation, what are the resources that you have, no? Because self-care need not be expensive. Kung ano lang yung meron ka, doon tayo magsisimula to do self-care. And of course, thinking positive thoughts, no? So this concept is quite gas-gas, no, for other people kasi nga positive thoughts really breeds positive result. But there is a process, no, before a person can arrive into a positive thought. No? You need to really process your emotions and not what? And not downplay your emotions. No? You need to really process it, talk to someone. No? We must make sure, no, that our emotions and the things that really affects us emotionally are being discussed, no, with a trusted person, no, before we can have these positive thoughts. There must be a process before we understand that we need positive thoughts and that we can think positively. Okay? Okay, the best way to make any behavior change is to make it as simple as possible, realistic and achievable. So self-care is very important. No? You have to put time and importance to self-care. Kahit napaka-busy po natin, 10 minutes, 15 minutes, these are all very important time to really take care of ourselves. Okay. So I have number one tip. Prioritize sleep. Okay. Your mood and immune system are counting on it. Based on Digulio and Millard article. Getting enough good quality sleep keeps your immune system running at its best to fight off infections like the one caused by the new coronavirus. Okay, prioritize sleep. No? This is based on the World Health Organization guidelines for people, no, who wanted to maintain a healthy well-being in times of the pandemic. Tip number 2, okay, pajamas off. No? Sometimes you feel sluggish when you are doing work from home. Or sometimes you feel sluggish or tired or exhausted if you are studying at home. Okay? So when you wake up in the morning, no, Beck Institute is telling us, pajamas off. No? Take a shower and wear your best attire even though you are working or studying from home. Because pajamas off is really setting your mind, no? Setting your mind that you are not sleeping anymore. No? You are doing an activity, no? So you have to prepare your mind to mental set yourself, no, by really doing pajamas off, no, and you really dress up, no, because you are ready. You are telling your brain you are ready to face the day. Okay, because our brain works based on how we prepare it. No, yung mental setting is very important. If we put a premium or importance to self-care, no, and we tell our brain, I need to have self-care for 10 to 15 minutes a day, no? Then our brain will remind us, no, that you need to do self-care. If you are not really thinking about it, your brain will not think about it also. Kasi what you picture in your mind, what you say to yourself, your brain understand it. No? Okay, tip number 3, refresh your senses. After a long work or a longer study periods, you get tired. No? Refresh your senses by drinking what? Coffee. No? If coffee is not allowed because of your health condition, no, look for something, no, that best suits your dietary requirement. Tip number 4, take short breaks in between, like synchronous classes if you are a teacher, If you are a student, no, take short breaks. No, go outside and feel the air by taking deep breaths. So later on, I will teach you how to do breathing techniques. No? Okay, breathe in, take a deep breath, be aware of your body relaxing, let out unwanted energy and tension. When you do a mindfulness exercise, you are identifying parts of your body which is tense or feels tired, no? And you address it. One technique is doing deep breaths and letting the tension, no, going to go out of your body, leave your body, so that it will what? It will address the tense muscles, no, the tense part of your body as you do breathing in and breathing out. No? Taking deep breaths is really very good technique for self-care. Tip number 5, play with your pets if you have one, okay? Your pets let you step outside your own house. Tip number 6, so work it out, okay? Staying active not only keeps your body healthy physically, keeping your risk of chronic health issues down, and lowering your chances of acute illness like COVID-19. It also helps, no, yung sa mood natin, no? Because exercise releases endorphins, hormones that make you feel good, and sharpens focus and aids sleep. Staying physically active also lessens the risk of mood disorders, boosts energy, and improves mood overall. So sino po ba dito yung nag-exercise, no? Kahit na 10 minutes siya, 15 minutes siya, it's very important. And then, caring for yourself. Tip number 7, less news, okay? And also have social media break. Huwag yung laging hawak-hawak yung cellphone, tinitingnan kung ano nangyayari, di ba? Sometimes, just let yourself relax, okay? Stop social media. Stop using your cell phone. Give yourself time to rest and be at peace, okay? And sometimes social media gives us additional stress, especially if we are reading fake news. And also if we have our enemies, no, posting positive things about themselves, na-stress tayo. Joke lang po yun. Pero no, we need to have social media break, okay? Care for yourself, give yourself time to rest and be at peace. Tip number 8, no, playing board games with your family. Okay? To lessen time with our cell phones and social media, no? Playing board games with your family is really fun, no? Now we are doing this, no? We are playing Monopoly, Scrabble, Exploding Kittens, no? And we are having so much fun as a family. And we are spending less time using our cell phones. That's only tip number 8. Okay. So give me a thumbs up if you are doing the following. Baking. Sino po rito mahilig mag-bake? Baking. Thumbs up. Taking care of your plants. No? Sino po dito yung mahilig mag-take care of plants? Mga plantito and plantita. Okay? Ako, mukhang marami. Next. How about some of you writing a book? Crocheting. No? Yung mga handworks na yan. So, wow, marami din. Pero pinakamarami po yung mga plantito and plantita. So, congratulations, no? Because taking care of plants give us positive energy. Okay? And it's very good, no? During a pandemic like this, no, to take care of our plants. Drawing and painting. No? If you wanted to draw and paint for the longest time, try it. Do it. No? Start by buying something, no, that will enhance your drawing skills and your creativity skills. Tip number 9, because it is a hobby. Explore a hobby. Start now. Self-care comes with the idea of nourishing yourself on every level, and doing something creative can promote, no, healthy well-being and the feeling of well-being. It's based on the article of Tonya Dalton, The Joy of Missing Out, Live More by Doing Less. That's a very good book. Explore a hobby. Start now. If you are thinking about it for the longest time, it's time to start now, okay? Next, tip number 10, prayer. Because prayer calms the mind and relaxes the body. This is a very good self-care, especially if you have many concerns, no? If you are stressed out the rest of the day, no? You can pray, no? Because it calms the mind and relaxes the body. So the study of Michael Persinger and Raman Kandran, no, in 1990, this area is located among the neural connections in the temporal lobes of the brain. So every time there is a discussion about spiritual things, no, nakita nila during scans with positron emission topography, these neural areas light up whenever research subjects are exposed to discussion of spiritual topics. Being close to God in time of pandemic, this is very positive. I am a Christian. I'm a Christian counselor. I'm a Christian psychologist, and really doing activities inside the church. If you have the chance to go to church, even though they have very limited number, if you can go, why not? But you have to really do all the safety measures. You can also do praising and worshiping inside the homes, inside the safety of your homes. There are many podcasts, webinars also pertaining to our spiritual needs. So because a study of Fardin, 2020, COVID-19 epidemic and spirituality, a review of the benefits of religion in times of crisis, the results indicated that spirituality could aid people to have mental relaxation in times of crisis and dangerous diseases. Okay, spirituality is very important. If you have a relationship, a personal relationship with God, it will take you really to be positive even though you are in the midst of a pandemic. Because God promised us not to fear. Fear not, for God is with you. No? And is it really incidental that there are 365 verses in the Bible that tells us not to fear? So God is what? God is admonishing us that every day we wake up and open our eyes, we must not fear. Because God will still be in control, and God will always be with us, and He will never leave us, and He will never forsake us. Okay, and Romans chapter 12, verse 2, and be not conformed to this world, but be transformed by the renewing of your mind. So every time you come in prayer, you are giving your concerns to God, there is a transformation in your mind. And it allows you to think positively and leave all your concerns and worries to God. This is being admonished by Apostle Paul, that if the world is being anxious and worried, and if we have a relationship with God, let us not be like them and transform our mind by renewing it every day because of God's presence and God's love for us. And Philippians chapter 4, verses 8 to 9 is telling us, finally, brethren, whatsoever things are true, whatsoever things are honest, whatsoever things are just, whatsoever things are pure, whatsoever things are lovely, whatsoever things are of good report, if there be any virtue, if there be any praise, think about these things. And the Bible is the first advocate of positive psychology. The Bible is very positive because God wanted us to think positively and to give our cares to Him. In 2 Peter, God is telling us, cast all your cares upon Him, for He cares for you. And I will teach you breathing technique. Are you ready? You can open your cameras if you like, or you can have it off cam. Okay? So very important is to have a knowledge of simple breathing exercise. Okay? Have you tried breathing exercise? So breathing and thinking are the two most important processes, one for sustaining life and the other for giving it a purpose. So one way to break up any kind of tension is good deep breathing. Okay, if you're ready, if you have not tried this is very good, okay? You just need to trust the process, okay? So there are many relaxation techniques. Some will allow you to inhale through your nose and exhale through your nose also. Ang nakikita kong problem doon, pag meron kang colds, you cannot breathe in through your nose and breathe out through your nose. So what I did is, you can breathe in through your nose, but you have to breathe out through your mouth. Are you doing it? This is very good. Breathe in through your nose, breathe out through your mouth. Breathe in through your nose, breathe out through your mouth. Breathe in, breathe out slowly. Breathe in, breathe out slowly. The right way to breathe is not to be tense, okay? When you do the breathing in, your shoulder should be relaxed, okay? Your shoulder should be relaxed. Huwag niyo habulin gano'n na para kayo nalulunod. Imbis na ma-relax ka, lalo ka matitense, okay? So you have to do it right to be able to reap the benefits of deep breathing. Okay? Inhale, exhale slowly. Inhale, exhale slowly. Inhale, exhale slowly. This time, we will hold it for 2 seconds, and then we will breathe out by counting 1 to 5. I will be the one to count, okay? Breathe in. Hold on, 1, 2, breathe out. 2, 3, 4, 5. Breathe in. Hold it, 1, 2, breathe out. 2, 3, 4, 5. Breathe in. 1, 2, breathe out. Breathe in. 1, 2, breathe out. 3, 4, 5. Breathe in. 1, 2, breathe out. 3, 4, 5. This time, we will do it with music, okay? I hope you can. I will stop share first. Okay. So, I will share screen. Okay, let us listen to this music as we do our breathing, okay? You can close your eyes if you want to really concentrate. You have the freedom to do so, okay? Breathe in, breathe out slowly. 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 Imagine you are in a beautiful place. You are in the midst of a garden with many flowers. You are in a place with a beautiful lake, and you wanted to feel relaxed and calm as you breathe in and breathe out. Breathe in, breathe out. Breathe in, breathe out. And you started to feel very positive. You started to feel very happy and thankful. You started to thank the Lord for all the blessings He has bestowed in your life. You thank Him for your loved ones. You thank Him for your blessings, for your work. You thank Him for the friends you have in your life. And you started to feel calm and relaxed as you breathe in and breathe out. Breathe in and breathe out. Let all the tension leave your body. Let all the stress of the day leave your body. And you will feel relaxed. You will feel calm and at peace. Breathe in and breathe out. Inhale, exhale. Inhale, exhale. And you started to feel the love of God envelop your body. And you started to feel safe in His arms. And you started to feel okay. And you started to feel warm and comfortable, calm and at peace as you breathe in and breathe out. Breathe in and breathe out. Breathe in and breathe out. At the count of 5, you started to feel more alert and awake. At the count of 4, you are adjusting your body and you are feeling the environment in your room. At the count of 3, you are becoming more alert and awake. At the count of 2, you are feeling more alert and awake. And at the count of 1, open your eyes now. And you are now refreshed, calm, and rejuvenated. Okay? So were you able to experience the calmness of our breathing? So I will end by saying to you, self-care isn't selfish. Okay, you need to really care for yourself in times of the pandemic. It is very important. And if you need, uh, if you have a mental situation or a mental concern, or mental health concern, MindSpeaks Psychological Clinic also. I'm the psychologist in this clinic. So we have also a web page. You can also contact me using my email and also the contact number. And we have the inquiry form also. So thank you and stay safe and healthy. God bless all of you. Thank you.
So, Din Myla, question. How to be effective in helping people who suffers from trauma?
How to be effective.
Mm.
Trauma is one issue na medyo seryoso talaga. Mabigat kasi pag trauma. Pag trauma, if it's a loved one, listen well. Kaya nung sinabi ko kanina, listen well and really convince that loved one to seek professional help. Lahat kasi ng mental concern o mental condition, meron niyang deteriorating factor eh. Lumalala siya through time. So kung meron ng mga symptoms, no, at nakikita nyo na dati napakamasayahin niya, no, napaka-productive niya, tapos biglang it drastically affect the functioning of the individual. No? Number one is to listen. Listening is a great help. Akala nyo lang wala kayong nagawa, pero napakahalaga. Listening and being there during that critical time, no, na nagkakaroon siya ng traumatic no, na-overwhelm siya, no, and you are there, listen, no, try to calm the person, and then talagang refer sa mga experts, no, sa mga mental health practitioners. No, they are trained to handle such cases.
Okay. Siguro follow up dun sa question na yun din, Myla, is what if yung person is not, doesn't want to share what she is feeling?
Pwede sabihin natin na help is available kahit ayaw mo sabihin sa akin. I know someone, I know a link or a telephone number or someone, no, that you can link to be able to help you, no? Kahit you need to really respect pag ayaw mag-share. Pero kung meron kang information, malay mo, di ba? She will reach out on her own. Pero meron kang ibibigay na information. I think Mary and I will be doing a project like that. No? Yung nakalagay talaga yung mga information natin. No? Because we are training some volunteers also for psychological first aid, PFA. So if you want to join, no, meron din po kaming training on PFA. Mga volunteers po yun and advocates.
Yeah, speaking of that, we have our second batch of training of PFAs, yung psychosocial and psychological first aid training. This will be happening on February 18 and 19. 2 days po siya, 1 to 5, both days. So if you're interested, just give us your
It's for
name.
free.
It's for
It's a
free.
free training.
If you only YWCA. It's a free
Only
training
YWCA.
open to wires and non-wires po. Another question, what programs are best for teachers to promote a mentally healthy school environment in this era of change?
Okay. So in schools, no, I'm very happy to tell you, ma'am, that in schools, we have guidance office. No? Guidance counselors are uh, are being tapped. No? They are the ones doing the mental health program. No? In our university, in University of Perpetual Health in Molino, our counselors are really very active. No? They are really proactive. Actually, kanina lang meron kaming self-care for employees, no? And it's spearheaded by our guidance and counseling office. No? So kung meron po kayo niyan sa inyong sa inyong mga schools, no, the guidance will be the one to do that, no. And you can recommend, no, you can recommend to have a program already kasi nga based on the law, okay, all educational institutions should have mental health programs, even companies, even organizations, and more so on the community level, on the barangay level. Kailangan meron tayong mga mental health programs already. Kaya nga maganda rin, siguro with Attorney Gruta yung batas di ba? May batas kasi on talaga, on mental health na hindi pa alam ng mga tao. We are not aware of it.
That's what I'm discussing earlier nung nawala ka sa air. nawala ka sa
kanina.
air. nawala ka sa Zoom. The YWCA last September and October did the understanding the Philippine mental health law. It was discussed by Attorney JB Gayona. But we stress on the employment part because at time there are many companies that is closing because of the pandemic and yung effect of losing your job, anong protection mo under the law. So you can watch that sa YouTube channel ng YWCA Philippines and of course sa Facebook. But of course, you subscribe on our YouTube channel. Makikita niyo po doon, it's a 2-part series so you will, it was explained thoroughly kaya naging 2-part yung discussion. I think this is only last week when we had this, the webinar on from mom to teacher mom. Probably for teachers also, you can get insights from the talk of 2 teachers coming from, one is the head of the Teachers Dignity Coalition, and the one is a public school teacher from San Pablo, Laguna, where she discussed her experiences as a mom of 3 children and as a teacher also. So I think these are opportunities for you to learn. And there's also a mom, a work from home mom of 2 young kids who are studying, which you can also learn from how she managed and organized her tasks from being the worker of a company and the mom and a teacher at the same time sa kanyang mga anak.
So, napakahalaga na yung self muna. You need to be well to be able to help others. That's why I'm really advocating for self-care, especially us, that we are directly directly involved with clients. So we need to really do a lot of self-care. Okay, and also if you are in the helping profession, you need to really be trained in handling cases. Kasi nga, merong mga vicarious traumatization, based on study kanina, di ba? If you lack clinical experience, tapos basta nandun sa study, pati age nga very open ka kasi, magiging open ka kasi you will be exposed to negative feelings of people na na-isolate. Merong mga cases na after COVID-19, they had PTSD or ASD. So, kailangan natin ng training to be able to help people and also to really take care of ourselves. Very important that we take care of ourselves kasi nga tayo yung tutulong Kailangan tayo yung healthy. Number 1 is taking care of our physical body, like exercise. Number 2 is our emotions. Less wag mo masyado expose yung sarili mo sa mga news, Kasi nga yung news, lahat negative, Minsan nahirap manood ng news laging negative And also, spirituality. If you are spiritual, and if you have napakalaking bagay yung spirituality natin, lalo na sa helping profession. Kasi nga, praying is a very good outlet ng mga stress. I think marami will agree na pag nagpe-pray tayo, we are giving to God all our concerns. We are giving to Him all our worries. We become well. So, kailangan yung sarili mo na yung well to be able to help others. Kaya mahalaga po yung self-care. So, if you are a psychology major, please talagang kumpletuhin ang training, ang pag-aaral. We need you in the field because we are very few. Very few. I think per 150,000, isa-isang psychologist, 150,000. Hindi naman natin kaya i-address yung 150,000 1,000 na katao na nag-iisa.
So kung may mga students dito or mga senior high school students at nag-iisip ng course,
psychology.
psychology, ang laki ng workforce na
Dito sa
kailangan.
Molino, if you are in Bacoor.
So another question, how to deal with people with slowly affecting trauma?
Ang mahalaga, spending time with them. Parang you give quality time really to listen. Kasi nga, lalo na tayong mga mothers, di ba? Napakalakas na ang pakiramdam natin pag something is really wrong with our children. We know. Parang nafe-feel natin yun. So when we feel that, we need to be available. Kalimitan kasi yung mga clients ko. I love adolescent clients. Marami ako adolescent clients. Ang number one na problema nila, there's nobody to talk to. Parang feeling nila wala nakakapansin what is happening to them. So being available and spending time and by being there. At saka, yung mga Filipinos kasi iwas tayo sa mental health issues. Ayaw nating tanungin talaga. Although nararamdaman na natin that there is something wrong. So pwede nating, anak, meron ka bang pinagdadaanan? I'm just here. Pero if you don't want to talk to me, you have to reach out. Sino ba yung gusto mong pagsabihan? You feel comfortable. Tapos meron ako mga contact numbers for psychologists or counselors. It's time to really discuss it with them kasi nga, minsan iniiwasan natin, akala natin it's just a phase they are going through, right? Dahan-dahan naman bago maging depression, nagsisimula sa severity yan na mild, moderate, severe. So pag may nakita na po tayo na kakaiba, it's time to really talk heart to heart. It's time to face it. Kasi nga, minsan full-blown na bago pa po makapunta sa mga mental health practitioners, like counselors or psychologists. Tapos meron pa tayong mga stigma na pag pumunta dyan, baka isipin ng kapitbahay, baliw yung mga pamilya na yan. Let's stop it. Let's end the stigma. Kasi nga yung mental health condition po ay para ring diabetes siya, lagnat, masakit na lalamunan, ganun din po siya. Physical nga lang yun, sa atin mental. So, kung yung physical condition natin needs a doctor, a medical doctor, so yung mental health condition natin needs a psychologist, a psychiatrist, and a counselor. Ganun po. You have to be there for the person.
Do you think catharsis through writing a personal journal helps our mental health or those people na ayaw mag-share sa ibang tao?
Writing is therapeutic. Writing and journaling is part of CBT actually, cognitive behavior therapy. May part dyan na tuturuan mag-journal yung isang tao, yung isang client. Especially if he or she is very, not very open to share their thoughts and feelings. Sometimes we do journaling also for, halimbawa nagawa kayo ng session today, So, and the client wanted to write about it. So, journaling is very good because it's therapeutic, Yung hindi mo masabi na po-project mo doon sa iyong papel. Hindi mo masabi na I love you, I care for you. Pero sana eventually masabi mo din, di ba? Pag lang isulat doon sa journal. Kasi nga, we need to really express ourselves. Lalo na pag meron na nangyayari sa atin, be open. Be open. Do not be afraid. Kasi nga, pag natakot ka at lumalala na yung mga symptoms mo, parang physical condition din. Pag yung isang sakit, hindi mo in-address na maaga, at naging stage 4 na, mahirap nang gamutin. Ganon din sa mental health. Pag pinatagal mo siya, at it will be a full-blown mental health disorder, so medyo mas mahirap siya pagalingin. Kesa yung nasa mild pa lang or there are few symptoms pa lang. Pwede ang journaling.